So, wait. Chronic pain. Cause of chronic pain, malalignment. It's real simple. Chiropractors, go see them. We have two right here, Dr. Hillquist, Dr. Roan. I've known them for both of them for years, and they're excellent. Leave some cards. So they maintain alignment. Now, cause of chronic pain is malalignment. Okay, now this is your normal vertebrae here. You have, oh, I can use my thing again. This is your nucleus pulposus. It's like a shock absorber. So, next slide. Is this unbelievable? Have I been talking for an hour and a half? Okay.
All good stuff.
Okay, here we go. This is the way the body's supposed to work. Up and down. Pressure should be in this vector. The problem we get into, and it can take a tremendous amount of weight, thousands of pounds. But when we twist and then lean, you're putting a vector, and what happens is you squish this disc to squirt out. And when it squirts out, then it goes on nerves and you get back pain. Next one. Okay, here's the answer to back pain. My results are better than, and I hate to say this, guys, but it's true. My results as far as treating back pain are better than anybody else's in the world. Sorry. But the back surgery is probably one of the worst things you do. Orthopedic surgery, it's not very good. Okay? See, I love doing what I do because everything I do works. Okay? Like I do hair transplant surgery also. And because people are happy to get their hair back, you know, and they look good. Okay, but anyway, chronic pain. The cause of chronic pain is malalignment. So what happens? Okay, and this is another big disconnect. Orthopedic surgeons, neurosurgeons, most of the time, they don't examine the patient. They're looking at x-rays and MRIs. Well, and this technique that I learned, it's called prolotherapy. And I learned it from a Dr. Ongley, who's now in Mexico. He was so successful, the orthopods got him kicked out of the country. So now he has a clinic in Mexico, in Ensenada. Anyway, here is the cause of chronic pain, malalignment. And when you have an accident, what happens is, everybody thinks, you guys, doctors, think the body's held together by vertebrae, you know, bones. Well, yes and no. But the bones are held together by ligaments, tendons, and cartilage. And so when you have a whiplash injury, which I see a lot in San Marino, then what happens is you've torn the ligaments in your neck or back. Now, all these people, if you ever had an auto accident, you go to the ER, take an x-ray, negative. Oh, because x-rays don't pick up ligaments, they pick up bones. Well, you have torn ligaments. Now, what happens is the orthopedic surgeon or the neurosurgeon will give you an anti-inflammatory. The anti-inflammatory reduces the inflammation, reduces the pain. But in inflammation is also a healing substance. So right in the anti-inflammatory, if you read the Vioxx, Celebrex, Motrin, it says may prevent healing. It does prevent healing. Prevents inflammation, prevents the healing aspect. So you never heal. So eventually, you have instability, bone, rub, and now the bones are rubbing on the nerves, it hurts, plus you see the changes in architecture of the bone because they're rubbing now, and now 8 months, 10 months later, you see on x-ray and MRI, oh, that must be the problem, right there. Let's go in there and fuse their vertebrae. The worst thing you can do.
So the inflammation is nature's way of
keeping
it together.
And that's one of the things I do. First of all, a patient comes to see me, and I get rid of the inflammation with a corticosteroid. First of all, you have to turn off the fire in the house before you can repair the house. Get rid of all the fire, all pain's gone. There's a big advocate of what I do over there because I've taken his neck and his back many times. Get rid of inflammation, you feel great, but that's not curative. Then I come back a week later, and then I go from examination, I determine which ligaments are torn. And it's really easy to make the examination. And I go ahead and I got another thing I got from Hippocrates. Remember, first thing, do no harm. Number 2, food is the best medicine. Number 3, prolotherapy. Hippocrates was the first prolotherapist. He was on the field of Olympia watching the Olympians prepare for the Olympics in Greece. And he was watching the javelin throwers. And he saw that some of them would anteriorly dislocate their shoulder. So what do you do? Brilliant. Brought the shoulder back into place, took a hot poker, scar tissue. Okay, I'm not using a hot poker. No, but the principle, I use the same principle.
Heat therapy.
Okay, what I do is I'll take some irritants, which are glucose, also phenol, very irritable. And I'll go right to where the ligament touches the bone. And prolotherapy is incredible. It repairs the ligaments. Okay, see, I'm injecting right here. Repair the ligaments. Next one. Okay, here's the patient I'm doing. And it's a big needle like this to go right into the spine. And I'm injecting very caustic stuff. So I better know what I'm doing because the spinal cord is right there. Anyway, it's not that hard, and it's very, very safe. Okay? Because what I do is I repair the ligaments around the cord and around the vertebrae. Now, this is back. 90% success. In the orthopods, in the Yale study, Yale's a pretty good place. Not as good as UCLA, but it's still pretty good. But anyway, in the Yale study, 57% of people that had back surgery 5 years later wish they never had it. That's not medicine, okay? I have 90% cure of backs. And I do backs, necks, ankles, knees. And people go, how can you do all of them? Because it's all the same thing. It's all joints, bones, held together by ligaments. And that's what's injured, and that's what you've got to repair in order to get the person well. Okay? And yes, ma'am.
Can you use that for a youngster with a sports injury to be just as well?
Okay, here's one of my guys that refers to me. He referred me, you remember the boy? He was a baseball player, and he tore his rotator cuff. Okay? And so I did about 3 or 4 prolotherapies on him. When we finished with him, he says, "Doctor, I'm stronger now. I can throw better."
Wow.
And also, I fix your shoulder too.
Yeah.
Yeah, okay.
Yeah, 9 years
Okay,
ago.
on shoulders, on backs I'm 90%, on shoulders I'm 100%. Never saw a shoulder I couldn't fix. Because it's real simple. You have a rotator cuff, you have 4 or 5 ligaments that hold the joint in place. And you just feel it. And if that's where you inject, you heal the ligaments, holds the joint in place. That's the cure. Where you go to the common doctor and he's giving you medications forever. That's not curing anybody. You're getting addicted to Vicodin or oxycodone. And not only that, the real tragedy is you get hard-working men and they have a back injury, a legitimate back injury, and they want to go back to work, and because of the runaround and the one doctor, another doctor, and pain medication, and blah, blah, and lack of focus, they go on disability for six months, and now they're sitting home watching TV and drinking beer. And pretty soon they don't want to go back to work. And now their back is much, much worse. Because the worst thing you can do is not use it. If you don't use it, you lose it. Okay, so the next one, next. Okay, here, I've injected, now we're up. Now we're rebuilding all the ligaments. And that's the answer. Now this is where I need to have chiropractors work with me. Is because while they're healing, they got to maintain their alignment.
I had a doctor that wanted to do back surgery on me, but I had to sign this thing saying that I may never walk again.
Absolutely. Oh,
Yeah.
you think it's that way?
I was like,
How about-
are you out of your mind? So I've been living with this pain for like 30 years.
Come to see me.
Yeah, I'm going to.
But the thing is, the thing is, the results of that orthopedic surgery are horrible. And why? Is because they're not solving the problem. Ligamentous, tendons, and cartilage.
Can you give him a shot to make him less ugly?
Actually, with the new research coming out, this may be one of these days of well, for instance, estrogen in women, testosterone in men makes the skin thicker. Okay? Collagen and elastin. So